And welcome back. We're going to pick up the discussion with how to maintain ideal blood cholesterol levels. So there's some key factors to consider in terms of ideal blood cholesterol levels and how you get there. So the first thing to factor in when you're looking at a person's blood labs is, does it look like they have some genetic predisposition to high cholesterol or high triglyceride levels, or do things look really erroneous? So you have to when you're looking at people's blood work, you have to look at that and always be a bit suspicious that there may be some underlying genetic problem with LDL receptors or apoprotein B100 defects, or an apoprotein E defect, or possibly apoprotein C2 or lipoprotein lipase. And when you're looking at things that sometimes don't make a lot of sense. But for most people, they don't have underlying genetic defects. They have faulty dietary and lifestyle problems. That's where their high cholesterol and or high triglycerides and high glucose is coming from. So with respect to getting cholesterol levels down, then you have to understand that keeping the saturated fat intake lower is going to be to someone's advantage, as well as keeping their trans fats down. So you don't overproduce cholesterol in the first place, or even with polyunsaturated fats, you're producing cholesterol, but you're clearing that cholesterol much more efficiently. The LDL receptor, there's a greater number of them, and they're clearing the cholesterol from the bloodstream. Whereas with saturated fat and trans fats, that's not happening. And also, what's their total cholesterol intake? Eating cholesterol, foods that have a lot of cholesterol, can also contribute to higher cholesterol levels. It's certainly not going to lower cholesterol by eating higher cholesterol foods. And then soluble dietary fiber helps to, excrete more cholesterol out of the body in the form of bile acids, as we've been talking about, and we'll revisit that. And then, of course, if a person's over-ingesting carbohydrates, once they fill up the liver carbohydrate fuel tank and send all the glucose that's required to the muscles for their muscle glycogen, and you're maintaining normal blood sugar levels, any extra carbohydrate is going to be converted into fat in the liver. And it's going to be converted into palmitic acid and oleic acid. And palmitic acid is a saturated fat that really turns on cholesterol production and tends not to, at the same time, increase LDL receptors. So you end up with more VLDLs and more LDLs being formed when you overconsume carbohydrates as well. So that can also raise cholesterol levels indirectly. And then with abdominal obesity, when people have more fat in the abdominal area, between meals that fat gets released into the bloodstream, travels back to the liver, and then the liver says, I've got to repackage you and send you back to the fat cell. In order to do that, it has to make another VLDL, another very low density lipoprotein, and to do that it has to turn on cholesterol production from acetyl coenzyme A to make the VLDL. And then you end up with more LDL particles as a remnant of that. So abdominal obesity tends to stimulate more, because it's metabolically active fat, you tend to increase the VLDL synthesis and then the LDL remnant particle as a result. So you have more triglycerides and often higher cholesterol levels as well when there's more abdominal fat. And then what's the person's aerobic exercise fitness status? Are they burning fat on a regular basis and keeping their blood sugar down and improving their insulin sensitivity? All of these things help to keep lipids into a more ideal range, not just glucose. So with that understanding, some of the key ways then to keep your cholesterol down is to decrease your saturated fat intake. So what does that mean? It means eating fewer animal foods that are high in fat, particularly beef and pork and high-fat dairy products, and chocolate that's made from cocoa butter, unless it's just a pure sort of dark chocolate. Even then, that still has a fair bit of fat. But chocolate products have a fair bit of saturated fat as a rule. And then palm oil and coconut oil, a lot of saturated fat. We'll look at this. Butter, mayonnaise, creamy salad dressings, a lot of pastries loaded with saturated fat. And then trans fats that are found in a lot of foods. So you want to look at the saturated fat content and the trans fat content of the foods that a person's eating. and also you want to increase their soluble fiber intake through certain fruits and vegetables, but particularly peas and beans. Chickpeas, red kidney beans, soybeans, other types of beans and peas, all very helpful. Black beans, all of them. 1 tablespoon of ground flaxseed a day, and or 1 to 2 teaspoons of psyllium husk fiber can lower cholesterol. Oat bran can lower cholesterol. And then artichokes have sort of multimodal effects on cholesterol lowering and also helping to keep glucose down, and we'll see that as we discuss artichokes in a few minutes. So there were a couple of articles published recently that I thought were really drove home the points that we're talking about here. One was the July 14th interview in 2016 with Dr. Catapano, who's the president of the European Atherosclerosis Study. And what he emphasizes that high LDL cholesterol is a main culprit in risk of heart and cardiovascular disease, a leading killer in our society, and that diet and lifestyle should be the first line of defense. He really made that point, that it's diet and lifestyle that should really be front and center at getting LDL down. He makes the point that all randomized studies conducted to date show that the safest value for LDL cholesterol is under 70 milligrams per deciliter or 1.8 millimoles per liter. That's where you want your LDL to be, below that level. The most recent 2016 findings from the Framingham Heart Study show that men are more than twice as likely to die from sudden cardiac death than women. Men ages 45 to 70 roughly have a 10% increased risk of dying from sudden cardiac death, whereas a woman, the risk is at 3 to 3.5%. But those with cardiovascular risk factors like high HDL levels have an even greater risk. And if you factor in high blood pressure as well, the risk becomes much higher again. So you start compounding these risk factors. And then also in 2016 in the British Medical Journal, a study published in the November issue confirmed that many previous studies had shown over previous years. So it confirmed what we'd been seeing in previous studies, and that is that saturated fat in the diet is associated with an increased risk of heart disease. So the study followed over 115,000 male and female health practitioners. They followed men in the health professionals follow-up study and women in the nurses' health study. These studies have been going on for a very long time. And the results showed that there was an 18% greater risk of heart disease in the group consuming the highest amount of saturated fats compared with the group consuming the least. An 18% greater risk in the group consuming the highest amount of saturated fats compared to the group consuming the least, almost 20% difference. The study also showed that certain types of saturated fat were riskier than others. The 3 most important saturated fats with respect to heart disease included lauric acid, myristic acid, and palmitic acid, these particular saturated fats. Now, beef products are very high in palmitic acid, and so are pork products. And so hot dogs and salami, bacon, sausages, very, very high in these disease-promoting types of saturated fats from palmitic acid. High-fat dairy products like whole milk, cream, most cheeses, butter, even 2% milk are very high in myristic acid and palmitic acid. And coconut oil, which is very popular these days, has a fat distribution that's 48% lauric acid, 16% myristic, and 9% palmitic. It has all of them. Coconut oil is almost entirely fat, and about almost 74% of the fats are the heart disease promoting fats. Now, what's fair to say about coconut oil is that coconut oil also contains medium chain triglycerides. And you can buy products in the marketplace that are just MCT oil, medium chain triglycerides derived from coconut oil. And the MCT oils are completely fine to have. They don't raise cholesterol, they don't make your blood sticky, they're not related to disease. They may even help to improve the body using ketones more effectively. But coconut oil in its native state has a lot of heart disease promoting fats in it. And when individuals replace the fats from these foods with plant-based protein, as they saw in this study, like soy products and peas and beans or polyunsaturated fats, there was an 11 to 12% reduction in risk of developing heart disease just by making that shift from those high saturated fat foods to more plant-based foods that don't have the saturated fats. And other studies have clearly shown that lauric acid, myristic acid, and palmitic acid raise cholesterol to the greatest degree. Of all the fats, those are the ones that tend to raise cholesterol to the greatest degree. They're found in red meat, pork, dairy products, palm and coconut oil to the greatest degree. And then, of course, trans fats also raise cholesterol, and trans fats lower HDL, which makes things even worse. But so you can't just finger trans fats as the big problem, because saturated fats are still contributing. Now, this is one of my heroes, Dr. Dean Ornish, who's a medical doctor who's done some fabulous research. He wrote the book called Reversing Heart Disease. He's the person that has the right to write a book called Reversing Heart Disease, because he's done it. He's been able to show on pre and post angiography studies that using his diet and lifestyle techniques and program, that he's been able to, in people with advanced atherosclerosis in the coronary vessels, he's been able to open up the wall of the artery and reverse the plaque significantly and improve the person's cardiology parameters on looking at S2 segment depressions and stability and treadmill testing, stress testing of the heart, and decreasing angina. This is the one person who's been able to do it. So his program is for people with advanced stage heart disease, and so it's a bit more restrictive than general recommendations for non-high risk people. But the program's been proven to reverse atherosclerosis. I mean, reverse it on showing and proving it on pre and post angiogram studies. So you can actually, in other types of studies as well, imaging studies. He precludes from his diet not only beef, pork, high-fat dairy products, and vegetable oils, but also he doesn't even allow chicken breast or turkey breast or even fish. So it's basically a vegan or plant-based diet with a bit of non-fat dairy products and egg whites and some nuts and avocado. He includes soy products as a source of protein and to help, which also he says helps prevent cancer as well as heart disease. Well, the whole diet really does that. As well, the Dean Ornish diet has been shown to help to stabilize mild to moderate degree of localized prostate cancer in a clinical trial with men, and it's shown to improve glucose, cholesterol, and blood pressure in high-risk patients, including diabetics, and also helps to reduce body fat in overweight patients as well. It really is a gold standard diet, I must say, for people that are in a high-risk category. It really is the best of all worlds, and studies show that the Dean Ornish program has given us a blueprint for the healthiest diet and lifestyle program to strive for. So he has the evidence to demonstrate that when you take those types of bad fats out of the diet, the good things happen. And in following my own patients over time, I would say that he's 100% right. I get dramatic results in lowering people's cholesterol, triglycerides, and glucose when I take those bad fats out and move them from high glycemic foods to lower glycemic foods, get them exercising, losing weight, and putting more plant-based protein foods into their diet. It can have dramatic effects on their lipid and blood profile. So having said that, I'm going to introduce you now to this fellow named Dr. William Castelli, who's the past scientific director of the Framingham Heart Study, the longest running heart disease study that's ever been undertaken. And Castelli noted a couple of things, that people that have a fasting blood cholesterol, as I said in a previous video, that's under 3.9 millimoles per liter or under 150 milligrams per deciliter, if their total cholesterol is that low, generally these people don't have heart attacks. So I really have worked very hard to keep my total cholesterol below 3.9. And what he said was that the average American that he was following in this very large study consumes about 70 to 80 grams a day of saturated fat alone. And he's saying really where you need to get to. Your body has no requirement for saturated fat at all after the age of 4 or 5 years old. But if you're going to have foods that have some saturated fat, he's saying the most that an individual can really handle before problems begin is somewhere between 10 and 20 grams a day. He likes to keep people's intake below 20 grams a day, preferably no more than 15 grams of saturated fat on any given day, with the understanding that you also want to keep your cholesterol intake low and keep trans fats very low. But for saturated fat, he targets under 15 grams a day. So let's just look then at some food charts, because no one likes to look at them. So I'm just going to bring some things to your attention here. This is the amount of saturated fat in 100 grams of edible portion of a food, or about 3.5 ounces of a food. So in certain types of pork products, in just 3 ounces, you're already at, remember, you're trying to stay under 15 grams a day. So here you are already at almost at 14 grams of certain cuts of pork. And so you see that these numbers for pork are actually extremely high. Remember, this is only 3 ounces. A lot of people have 6 ounces or 8 ounces, and so they're already getting more saturated fat just from a single serving of a single food on any given day. That starts to put them into the out of bounds region. Some cuts of pork have less. And then with beef, a lot of beef products are also very high, just in 3.5 ounces. A lot of saturated fat in beef products as well. And again, the kinds of saturated fats that raise cholesterol. And so you see sirloin and ribs and beef round, eye round, and a lot of these beef products that I haven't had in many years, actually. And then there's certain cuts of beef where the total fat is lower. So if you're going to have them, these would be the ones to maybe consider if you're going to have red meat. And then with chicken, depending on how it's prepared, and if there's skin on the chicken, if it's a leg, if you're deep frying it, even there can be a fair bit of fat in chicken, unless you start to get down just to turkey breast without the skin on it, and you just bake it or broil it. So you can get chicken that's low, down around 1 to 2 grams of saturated fat in a standard serving size, if you are really being careful with it. And then with dairy products, it's the higher fat dairy products can actually run up a fair bit of fat. Let's look at some of the more. Look at cream, 3 ounces of cream, 23 grams. It's unbelievable. And sour cream at 13. Unless you reduce the fat. And cheese is just like right off the charts. Most cheeses are just 3.5 ounces of a cheese, and you see it's already at 22 grams in cream cheese, cheddar cheese. Most of the cheeses are extremely high in saturated fat, and they're the kinds of saturated fat that raise cholesterol levels and make your blood very sticky. And then there's some reduced fat cheeses, but they still have a lot of saturated fat, even when the fat is reduced, until you get right down to these super low fat or non-fat cheeses, and that's when you start to have ones that are, in my view, a lot more acceptable. And then with egg yolk, there's 9.5 grams of saturated. Not only is it 250 milligrams of cholesterol, but you're also getting a fair bit of saturated fat in there. But again, if you have egg whites, you're getting absolutely no saturated fat. So I personally have egg whites, but I don't have the yolk. And this is just looking at chicken breast alone. So you see that the total fat is 3.6 grams in a chicken breast, or 3.5 ounces of chicken. And the saturated fat's only about 1 gram, which is, I think that's fairly acceptable. So if you had, 1 or 2 chicken breasts a day, you're like 2 or 3 grams of saturated fat, and you're getting a nice source of protein, 31 grams per 3.5 ounces. And chicken legs have a little bit more fat and a little bit more saturated fat. And if you're having it with the skin, then the fat's going to be even higher. So I have a little bit of the dark meat of chicken occasionally, but I really try to stay with chicken breast and turkey breast. And then there are these lipid-lowering drugs. I think we touched on these earlier, the statin drugs that inhibit cholesterol synthesis in the liver. And in that course, Essentials of Pharmacology, we'll spend way more time discussing these medications. These are the bile acid sequestering drugs that bind to bile and cholesterol in the GI tract to prevent their reabsorption into the body. These drugs like cholestyramine. Then you have fibric acid derivatives that help to stimulate lipoprotein lipase, so you can clear fats from the bloodstream more effectively. And they also raise the HDL level. And then high-dose niacin also can stimulate lipoprotein lipase and also raises HDL levels, helps to clear triglycerides out of the bloodstream, where people have more problems with triglycerides than they do with cholesterol. Then you're using fibric acid derivatives and high-dose niacin. Where it's more of a cholesterol issue, usually you're seeing statin drugs being used nowadays. And it brings us to cholesterol-lowering supplements. So I want to spend a bit of time here because these are fascinating. I really like these first two, gum google and artichoke leaf extract. So studies show that if you give somebody 1,000 milligrams of gum google 3 times a day, that's standardized at 2.5% glucosterones. That would then release about 75 milligrams of glucosterones to the system. That those glucosterones have a cholesterol-lowering effect. We will look at this. Same is true for artichoke leaf extract. If it's a standardized grade and it's the right dosage, then it can help to lower cholesterol as well. With garlic, even though garlic extract can lower cholesterol to a modest degree, it can also cause internal bleeding, and it can decrease platelet coagulation to such a degree. There have been internal bleeding disorders associated with garlic extract supplements, so I tend not to recommend them. And with gamma-rosinol, again, this is a supplement that's usually used in women going through menopause to help manage hot flashes and other menopausal symptoms, but also it has a nice cholesterol-lowering effect in that situation. But let's talk about gum google. Gum google is really the resin of the mucal mirror tree that grows in India. It's been used extensively in the Indian medical system. In 1986, it met government approval as a cholesterol-lowering medication. What gum google does is it increases LDL clearance of cholesterol by the liver. So the liver picks up more LDL cholesterol particles. It enhances that to clear LDL from the circulation. It's been shown to reduce total cholesterol in a few preliminary studies by 14 to 27% in just 4 to 12 weeks. I have seen gum google lower cholesterol 30% in some of my patients. It can also lower triglycerides because it's clearing some of those triglycerides from the system as well by improving the receptor function, we think, on the liver, up to 30% in 4 to 12 weeks. And it also improves the HDL to LDL ratio, which is, just remarkable. And it's extremely non-toxic. Has some occasional adverse side effects. We'll look at these. There was a great review paper on gum google that was published in Cardiovascular Drug Reviews in 2007. I'm going to give you the highlights here. In 1986, with proven efficacy and safety, gum google was approved for marketing in India as a hypolipidemic drug. Overall, about 70 to 80% of people who have high cholesterol show a good response to the lipid-lowering effects of gum google. There's about 20 to 30% of people who don't show any response to it. So when I recommend gum google to a patient, I know that there's about a 70 to 80% chance it's going to help to lower their cholesterol. But in 20 to 30% of people, it just doesn't have an effect. So I think where the person has a very strong genetic underlying problem where they don't make LDL receptors very well, particularly in those cases, it just can't overcome that particular obstacle. But for up to 80% of people, they see a reduction in cholesterol levels, particularly LDL, and it improves the total cholesterol to LDL ratio significantly. So I combine it with other dietary approaches, but I usually give them the dietary approach first. I see how far we get, and then if I think it's not getting me exactly where I want it, then I add a supplement that has gum google and artichoke leaf extract. So the conversion of cholesterol to bile acids and subsequent excretion through the enterohepatic circulation represents a major pathway to remove excess cholesterol from the body. So experimental studies show how glucosterones work. Number one, LDL cholesterol catabolism. Glucosterone has been shown to increase the uptake of LDL cholesterol by liver cells to remove it from the circulation. The glucosterones are also FXR antagonists. So what does that mean? Normally, high concentrations of bile acids in the liver inhibit the further conversion of cholesterol to bile acids. So once you have enough bile acid in the liver doesn't keep making bile acids from cholesterol. So this, once you convert cholesterol into the 7-hydroxy cholesterol, as you're going to see, then the body stops making bile acids from cholesterol. So let's just review this. Normally, the high concentrations of bile acids in the liver inhibit the conversion of cholesterol to bile acids by inhibiting the cholesterol 7-alpha hydroxylase enzyme, which converts cholesterol to bile acids. We're going to see this in a moment. The cholesterol 7-alpha hydroxylase is the rate-limiting enzyme in the classic pathway of bile acid synthesis from cholesterol in the liver. And so when you inhibit that enzyme, let's go back. When you inhibit this particular gene, then it stops this enzyme from being the rate-limiting step, and it enables cholesterol to continue to be converted to bile acids on an ongoing basis. So we think that that glucosterones, one of the ways that it lowers cholesterol is by increasing the conversion of cholesterol to bile acids and not allowing this rate-limiting step to actually stop the process. And so you convert more cholesterol to bile acids, and then using this bile salt export pump, so the BSEP agonist, the glucosterones upregulate this bile salt export pump, which actually pumps more of the bile acids through the biliary tract, so you excrete more into the intestinal tract. Studies show that you increase bile acid excretion by 57% in the presence of glucosterones. So not only are you converting more cholesterol into bile, but you're also excreting more of it into the intestinal tract. And then from there, you're going to be able to get rid of some of that through the fecal route. And as you convert more cholesterol to bile acids, then the liver will clear more LDL cholesterol from the bloodstream because you're excreting it. Now you have to make more bile acids. So you're just getting more cholesterol out of your body through the fecal route. And then glucosterones have also been shown to decrease LDL cholesterol oxidation, so it makes the LDL cholesterol less atherogenic. And it's been shown to increase HDL cholesterol in about 60% of patients when they're being treated for high cholesterol problems. Now, glucosterone also has been shown to inhibit experimentally nuclear factor kappa beta, which is a major transcription factor that stimulates the production of inflammatory cytokines. And so for that reason, glucosterones have also been used in the treatment of certain inflammatory and rheumatic conditions sort of historically. So here's what this looks like schematically. Normally cholesterol, when the body wants to make bile acids, it gets converted to the 7-hydroxy cholesterol, and from there it forms the different bile acids, and then from there through bacterial transformation in the gut, it can form these final secondary sterols, deoxycholic acid and lipocholic acid. But as soon as you have a lot of 7-hydroxy cholesterol, then that receptor, the FXR gene, then it stops the synthesis of the 7-alpha hydroxylase, so you stop converting cholesterol. So glucosterones remove that inhibition, allowing cholesterol to continue to be converted to 7-hydroxy cholesterol, so you make more cholic acid and other bile acids that then get excreted into the intestinal tract with more efficacy. So you're converting more cholesterol to bile acids, and therefore the liver is going to clear more LDL cholesterol from the circulation, bringing your LDL cholesterol lower. So this is where the Google lipid, it enhances the conversion of cholesterol to bile acids right there by removing that rate-limiting step inhibition that we saw in the previous slide. And just one last look at this. So cholesterol, using that 7-alpha hydroxylase enzyme, gets converted to the first form, and then from there it can become these primary bile acids, and then once the bile acids are excreted into the intestinal tract, bacteria can act on them to convert them into secondary sterols like lithocholic acid and deoxycholic acid. Now, lithocholic acid and deoxycholic acid in high concentrations can do genotoxic damage to the epithelial cells of the large intestine and actually encourage cancer, colon cancer to occur. And so this is where, if you're also ingesting adequate amounts of calcium at the same time, say 1,000 milligrams of calcium a day, that the excess calcium you don't absorb can bind to cholic acid and chenodeoxycholic acid and make them into insoluble calcium soaps, so they can't be transformed into these more dangerous secondary sterols that are linked to colon cancer. I just thought I'd bring that to your attention. So higher calcium intake is associated with a lower risk of colorectal cancer, but that's one of the main reasons why, that it actually prevents the conversion to the more dangerous secondary sterols in the large intestine. Are there any adverse side effects to gum Google? Well, currently no clinical studies have been conducted to evaluate the safety of long-term use of Google or Google sterone. So the studies that we have following patients in published studies, there aren't really these long-term studies. Most of the studies are less than 6 months, but I will tell you that I've had many patients that are on gum Google supplements with artichoke leaf extract for years, and there hasn't really been any untoward side effect. If they get through the first few weeks without a skin reaction or some adverse event, then usually they're going to be fine for long periods of time, from what I've observed. No significant side effects have been observed on renal or liver functions, hematological parameters, or electrolytes. Such a safety profile is consistent with its long history of use in Ayurvedic medicine and practice. So a lot of practitioners have used this for many years, not only me. However, some adverse reactions have been noted in clinical trials. So some people have gastrointestinal discomfort, that's the predominant side effect, but other side effects include loose stools, mild nausea, and hiccups. But, this is important, skin rashes or hypersensitivity reactions have been reported in some clinical trials. In one study, 9% of participants developed a moderate to severe adverse cutaneous reactions within 48 hours of therapy. So the thing to look out for with gum Google is that it can cause a skin rash. And if it does, you have to take the patient off the product. There was one reported case of rhabdomyolysis a number of years ago. We don't think that's a major risk, but that's a very serious problem, of course, when sort of you have a breakdown of muscle protein that gets lodged now in the kidneys, and it can cause sudden kidney failure and death in the patient if it's not dealt with immediately. So, just always know that in the back of your mind that sometimes in very rare situations something really untoward could happen. So you just have to always be cognizant of that. Drug interactions and precautions. Well, the co-administration with Gugu lipid with either a beta blocker or a calcium channel blocker, it's decreased the bioavailability of the two drugs. The thinking is that these drug reactions are likely due to the activation of the PRX enzyme system by glucosterone. So glucosterone may be upregulating a particular detoxification pathway that then ends up upregulating the detoxification of beta blockers and calcium channel blockers. So if the patient's on these high blood pressure medications and you give glucosterone, you might want to be just checking their blood pressure to make sure it's staying in the ideal range. That's really the clinical takeaway from there. And finally, safety in young children, pregnant or nursing women, or those with severe liver or kidney disease has not yet been established. So if someone has severe liver disease or significant decline in kidney function, I would not be recommending. There aren't very many supplements that I would recommend. And for pregnant and young children and nursing mothers, usually you keep them away from just about all supplements except for ones that are really targeted for their needs. Then with artichoke leaf extract, in a double-blind placebo-controlled study of 143 people with high cholesterol, artichoke leaf extract reduced total cholesterol by about 18% compared to about 9% in the placebo group. LDL cholesterol dropped by 23% versus 6%, and the LDL to HDL ratios declined by 20% versus 7%. That's pretty remarkable. So artichoke is known to increase bile acid secretion by the liver, so it helps to flush these bile acids through the biliary tract into the lumen of the intestinal tract, which in turn, as you flush out these bile acids, the liver runs out of bile, so then it takes in more LDL cholesterol, so then you get upregulation of the LDL receptor function. You clear more LDL cholesterol from the blood, and you convert that with the help of gugu lipid or gum google into more bile acids, and with artichoke you help flush it through. So cholesterol is the building block of bile acids, hence artichoke enhances the excretion of excess cholesterol in the form of bile from the body via the fecal route. And there's a series of different active agents in artichoke which we will look at. So here's this fabulous report in 2016 in the Journal of Food and Nutrition Research. This study was performed on diabetic rats to try to understand how artichoke leaf and artichoke, the head of the artichoke, is actually lowering cholesterol, because studies seem to confirm that it can do that. So the study showed that it reduced total cholesterol and LDL in 3 ways. Number 1, it converted more cholesterol to bile in the liver, and it excreted it into the lumen of the intestinal tract. It also inhibited cholesterol synthesis, and it inhibited cholesterol absorption from the gut, from the intestinal tract into the bloodstream in the very first place. Remarkable. Sort of like soluble dietary fiber would do. It also acted as an antioxidant to prevent oxidation of LDL, making it less atherogenic, and it increased liver protection against damaging agents as well. So it seemed to have some liver protection effects against some damaging agents, and it also helped to lower blood sugar and triglycerides in diabetic rats. So it had this glucose and triglyceride lowering effect as well. Artichokes are such a medicinal food, it's incredible. There are 5 major protective compounds in artichoke. Some are antioxidants, as you see. Some actually have cholesterol and triglyceride lowering effects. That's why when you have an artichoke leaf extract, if you're going to use it as a supplement, you want it to be standardized to caffeoquinic acid. That's the main cholesterol lowering agent. And luteolin also inhibits cholesterol synthesis, and you have some other antioxidant effects here. But these 5 compounds really work synergistically, according to the studies that we have, to lower cholesterol and glucose and even triglycerides to a certain degree. So here's the dietary application for artichokes. I'd say including artichoke heads and hearts and leaves in your diet 2 to 3 times a week may be really wise, especially if you're wanting to lower your cholesterol, help people reduce their blood glucose, support their liver health, boost antioxidant defenses. It's one of the highest rated antioxidant foods you could eat. It also contains a lot of dietary fiber. Artichokes are low in calories, but they're very filling, and they can be a healthy substitute for starchy carbs at a meal. I like to add them personally to salads, especially to a bean salad. So when you have a bean salad and you add artichoke hearts to it, with some olive oil and a little balsamic vinegar, let's say, you're getting it's like cholesterol lowering medicine that also helps to lower blood sugar, has a low glycemic index. So beans and artichokes are incredible, and then using a supplement that contains both gum google and artichoke leaf extract together. This is what I usually recommend to my patients with high cholesterol. It would be, the caplet would have 500 milligrams of gum google and 200 milligrams of artichoke leaf extract, and the gum google would be standardized to 2.5% google sterones. and the artichoke leaf extract would be standardized to 13 to 8% caffeoquinic acids, and you take 3 capsules 2 times daily with meals. So you're taking 1,000 milligrams 3 times a day with that particular combination. Or you're actually taking 700 milligrams in a capsule. So you're taking 3 capsules 2 times daily to get the total medicinal amount of the glucosterones and the caffeoquinic acids to actually have the cholesterol-lowering effect. So it's a lot of capsules to take. To take 3 capsules twice a day is actually a bit cumbersome or burdensome for the patient, but it does lower their cholesterol in people that have the willingness to remain compliant with that. So when we come back, we'll talk about the fact that it's not just cholesterol that causes cardiovascular disease. We're going to look at the other risk factors that sort of dovetail together into this story around atherosclerosis and risk factors for cardiovascular disease. So I'll see you when we come back shortly.